I believe that the power of the mind is so much more than we have ever known, ever been taught, or ever give credit. One of the things I would like to address is specifically on the mental, emotional aspects that you might be encountering right now, and how we can start to break that cycle and help you to start to have that positive outlook and help you start healing right now. The first of which is you've got to forgive yourself. Many women come in, they had their breast implants put in for body image, whether it was after having children and lost the volume or didn't have much volume to begin with, and you wanted to feel better about yourself. That's great, because you did, and they served you well for several years. However, if these are causing issues, it's likely not worth keeping them. Now, a lot of women tell me during the consultations that they feel badly that they did this to themselves. And I just look and smile and say, you made the best decision for you at that time. And if your plastic surgeon even mentioned breast implant illness, at least you heard about it. But most of the women that I see never even heard of breast implant illness until they had symptoms. I see my own patients from 12, 15 years ago before I got involved with breast implant illness. And I look at them and I just have to apologize. I said, I'm sorry, I didn't know. Otherwise I would have counseled you. I still put in breast implants. However, I go into great detail about educating my patient about breast implant illness. We also offer that genetic methylation detoxification pathway genetic testing. Some do that, some don't, but at least they have the information to make that informed decision. You can't change the past. If you were to go back today, with the information you had back then, you would likely make the same decision. You can't change that. So it's very easy for me to say at this point, but more difficult for you to do. But you need to cut that cord. That negativity, that thought process of beating yourself up, that I did this to myself, changes the physiology of every cell in your body. And what we need to do is say, thank you, implants. You served me well, but you're not serving me now. And now we need to make the decision today to change the future. You can't change the past. Forgive yourself for that. Enjoy the moments that you had. But now let's make that decision to move on. I have found ways to help with mental emotional baggage, if you will. Some of those are yoga, meditation, or prayer, depending on your religious beliefs. What I feel with this is we view ourselves not as an individual, but as a part of a whole. And when you see that, you're not alone. So practice those. It helps get out of yourself and into the rest of the world. And that gives you a sense of belonging and can take you forward. Speaking of moving forward, I'm a huge proponent of visualization. If you kind of visualize where you want to be 6 months after your explantation, the implants are out, you're healing, you're feeling better, your energy's coming back, you're down on the floor playing with your kids or your grandkids, you're out on a bike ride now where before you couldn't leave the house. Once you visualize that, your body, your mind actually starts to move towards that, and you manifest that, and it starts to become your reality. So keep that positivity. The positivity of your mind affects every aspect of your body. What is so rewarding for me is when the patients are recovering after the surgery. We get over the anesthetic, the pulling the drains, kind of all those physical things. But when they start to get that energy back, it's amazing how we change something from a physical anatomic standpoint. But when we see that mental, emotional change, they just brighten up. That's the way we change lives by doing this. And that is where I get my greatest joy.